add on to that. Thank you. So we're going to move to next item on the agenda, California Health and Human Services Agency, items 4260 and then 4265, Department of Healthcare Services. Item 1, high-cost drug proposal.
Mary Campbell, Department of Healthcare Services. I will certainly start from DHCS's perspective. Through this, a couple things are happening. One, the department has always, including in the January budget, maintained the cost of Hep C drugs, but this proposal also allocates to DHCS a portion of the $300 million set aside that was in the governor's January budget. Our department, along with the other departments impacted by this, have had more time to look at the actual data and utilization of services that we're seeing for these high-cost Hep C drugs, and that informed our revisions for the May estimate. Specifically, the questions that were directed towards us, as noted, we are also planning on updating our clinical guidelines. Those have not yet been released to the public. We are planning to release them by the end of this week, and certainly we will be inviting stakeholder input as we did with the initial guidelines. So they will be draft until we have the opportunity to receive feedback and then finalize them. In terms of the numbers of individuals who will be receiving treatment under these new guidelines, our estimate for the budget year assumes approximately 3,000 to 4,000 individuals will be receiving treatment. This is based on a combination of our experience to date and an expectation of around a 15% increase due to expanded guidelines. And I'll defer to my other colleagues here for the other items.
Hi, Nikki Dillon with the Department of Public Health. I'll briefly go over the Office of AIDS estimated net cost of $6.5 million to treat HCV co-infected ADAP clients, regardless of liver disease stage, in fiscal year 2015-16. ADAP will utilize available rebate funds and federal funds. There is no general fund appropriation for ADAP in 15-16. The ADAP Crisis Task Force, which the California Department of Public Health Office of AIDS is a member, successfully negotiated supplemental rebate agreements with the manufacturer of Vicarapac. As a result, Vicarapac is available at a lower cost to ADAP than other recommended treatment options. OA, in collaboration with our ADAP Medical Advisory Committee, updated our ADAP prior authorization form for HCV treatment. The prior authorization form prioritizes the use of Vicarapac due to lower cost among eligible patients when the regimen is equally effective and no medical contraindications to use exist. Clinicians who wish to treat their ADAP clients with a hepatitis C drug other than Vicarapac must provide clinical justification. The Office of AIDS is committed to ensuring that all hepatitis C infected ADAP clients have access to hepatitis C treatment medication that is appropriate for them.
Great, thank you. LAO or Finance, any comment on this item? Looks like we have some public comment. Please come forward.
Good afternoon, committee members. I'm Tam Ma with Health Access California. We appreciate the administration's efforts around this issue, and Health Access has supported other initiatives to deal with the issue of high-cost drugs here in California. We believe that a strategy around high-cost drugs and hepatitis C really needs to include efforts to reduce new infections as well. We've done this for HIV, and we believe that it should also be done with hepatitis C. The governor's May revise states that the Health and Human Services Agency is going to convene 2 work groups on clinical and procurement issues, and we urge the inclusion of health and consumer advocates in these work groups. And we appreciate the department's willingness to engage stakeholders on its new clinical guidelines for Medi-Cal. Thank you.
Thank you.
Linda Way with Western Center on Law and Poverty, echoing some of the comments of Health Access. We support the May revised proposal to increase funding to reflect new clinical guidelines, but have heard from legal aid advocates that providers on behalf of consumers have reported difficulty obtaining approval for Hep C drugs from Medi-Cal managed care plans due to the plan's different interpretations of the clinical guidelines. Advocates have asked DHCA for utilization data, but have not received such data, and we look forward for the opportunity to comment on the new clinical guidelines, so appreciate that opportunity.
Thank you.
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans. Of course, we support the state covering its costs in this area. we must say that $250 million supplemental down payment for one class of drugs is particularly worrisome. The state has signaled that there are costs in the future and coming in next year's budget, and that we should collectively be working together to figure out some solutions. So the health plans would like to be a part of those discussions, and we've appreciated being invited to the stakeholder meetings that have taken place. As a part of that process, we believe that there should be a discussion about the transparency and underlying prices, and a comprehensive look across state programs to get a real look of how many people in state programs need high-cost specialty drugs, whether they're Hep C or other types of drugs, and that can be LAO or another entity. We think it's important because the pipeline is getting jam-packed with a lot of drugs that are expected to be very high cost. A cholesterol drug is going to be coming on the market very soon. That's about $10,000 per year for folks that qualify for that drug. And so that's a drug they're going to be taking for the rest of their life. So it's these types of cost pressures in the program that can create some affordability and access issues. And we think it's a serious problem. Thank you.
Thank you. Senator Stone, anything on this item? No. We do have a recommendation to approve. So we have a 2-0, and we'll hold that vote open for the chair. Moving now to item 4265, page 38 of the agenda, item 1, AIDS Drug Assistance Program.
All right. Hi again. I'm Nikki Dillon, ADAP Branch Chief within the Department of Public Health, and I will provide an overview of the May revision proposal. So for 2014-15, the January governor's budget included ADAP local assistance funding of $384.9 million with no state general fund appropriation. The revised 2014-15 budget is $352.2 million, a decrease of $32.7 million, mainly due to two factors. The first is Medi-Cal expansion. A larger number of clients are transitioning to Medi-Cal expansion than was initially estimated, leading to greater declines in the number of ADAP-only clients. And the second is hepatitis C virus treatment. Fewer clients are accessing hepatitis C treatment than was initially estimated. The revised current year budget does not contain a general fund appropriation or any cuts to services. ADAP requests the following changes to 14-15 funding expenditure authority when compared to the January governor's budget. A decrease of $36.2 million in ADAP rebate funds, an increase of $4.5 in federal funds, and a decrease of $1 million in reimbursement funds, and that's safety net care pool funds. In 15-16, the proposed funding for the budget year is $389 million. OA estimates that expenditures will decrease by $25.9 million when compared to the January's governor's budget. Changes to the ADAP's budget authority when compared to the January governor's budget includes a decrease of $20.2 million in ADAP rebate fund expenditure authority and a decrease of $5.7 million in federal funds. And also, the May revise has two new major policy changes. One was expanding access to hepatitis C virus medications to include all HCV co-infected ADAP clients, regardless of liver disease stage. And the second is to reallocate $1.5 million in Ryan White base funding to support targeted efforts to re-engage HIV-infected minority clients in medical care and treatment.
Thank you very much. Anything from LAO on this?
Sean Martin with the Legislative Analyst's Office, and we're recommending approval of the ADAP May revision estimate, and we have no issue with the two other augmentations proposed.
Thank you. Department of Finance?
Hi, Kimberly Harbison, Department of Finance. For the stakeholder proposals, we just want to reiterate on the record that those are not administration proposals, so we cannot support them.
Great. Thank you. Any public comment on this item? Seeing none. Any questions, Senator Stone? We have three separate components here on this item. The first is to approve the revised ADAP May revision estimate, including the proposal to reallocate $1.5 million Ryan White-based funding to local health jurisdictions and/or community-based organizations to support targeted efforts to re-engage HIV-infected minority clients in medical care and treatment. We have a motion and a 2-0 vote holding it open for the chair. Then the next is to augment the allocation to the local health jurisdictions for ADAP enrollment by $2 million. Do we have a motion from Senator Stone on that one? And are you a no vote on that? So we'll record a 1-to-1 vote, 1 yes, 1 no, holding it open for the chair. And then the final augmentation by $1 million rebate fund to support efforts to work with enrollment workers, provide technical assistance on improving the ADAP enrollment process, increase capacity due to the projected changes in the program, and develop quality metrics for the ADAP program. So we have, I will move, and we have a 1 yes, a 1 no recorded, holding that open for the chair's vote. We'll move now to licensing and certification program, page 40 on the agenda. Good afternoon. Welcome. Please introduce yourselves and proceed.
Good afternoon.
It should be on. Just speak.
Good afternoon, Mr. Chair and members. I am Jean Icino. I am the Deputy Director of the Center for Healthcare Quality at the California Department of Public Health.
And I'm Scott Vivoni, Acting Assistant Deputy Director.
So, an overview of our May revision proposal. We changed a few of the inputs for updates for latest numbers for facility counts and complaint numbers in the estimate, but the major change is a proposal to increase the expenditure authority of $5.3 million from the State Department of Public Health Licensing and Certification Program Fund. This increased funding will be to augment the contract with Los Angeles County that we're currently negotiating to account for terms that were not included in the earlier budget change proposal. This would include 2 salary increases that the county has negotiated with nursing staff, one in October and one in April of this year, to take account of the appropriate employee benefit rate for Los Angeles County, to acknowledge the indirect cost rate, and to provide for supervisory staffing ratios that are comparable to the state's staffing ratios.
Thank you. Any comment from LAO on this?
Sean Martin with the Legislative Analyst's Office. As we've testified before in this, before this subcommittee, we recommend the approval of the LNC quality improvement projects and the approval of the Los Angeles County contracting monitoring. Previously, we withheld recommendation regarding the LNC workload and the Los Angeles County, or the Los Angeles County contract, pending release of a report that would provide us with information about the most cost-effective way to carry out these LNC activities. We still have not received that report. We acknowledge that there is a need for these positions to complete this workload. In the absence of that report, I can't tell you whether this is the most cost-effective approach. We've also testified previously that the salaries and benefits of the health facility evaluator nurses in Los Angeles County are higher than the salaries for comparable state workers, and pointed out that the LA County contract, as proposed in the May revision, would take into account recently negotiated salary increases for those nurses. Then there's, in addition, there is placeholder language to establish timeframes to complete complaint investigations in long-term care facilities. We don't have any issues with that part of the proposal. And there is also a proposal to increase funding by $1.4 million to the long-term care ombudsman program. And we don't have an issue with that proposal either.
Thank you. Department of Finance?
Kimberly Harbison, Department of Finance. We support the augmentation for the Los Angeles County contract, but we cannot support the non-administration proposals.
Thank you. And I would like to just go back to the department and ask if you could explain or review of the technical assistance provided to the subcommittee regarding establishing timelines for complaint investigations and funding for the long-term care ombudsman program.
Yes, so we'll start with the timeline. So the way that the proposed trailer bill language is established has staggered start dates for timelines of 90 days for complaint investigations, starting with an implementation in July 1st of 2016 for those complaints that are triaged as most serious and are most likely to result in a citation. And then following along in July 1st of 2017, the same timeline would apply to all of the rest of the complaints. The trailer bill language also is separated to put a timeline on the complaint investigation itself, and then another additional 30 days for preparing and issuing the citation.
Thank you very much. We're going to move to public comment now.
Gary Passmore with the Congress of California Seniors. First, we want to go on record in support of the department's proposal and the governor's proposal on the Los Angeles augmentation. We think it's an important piece of it. On the long-term care ombudsman proposal, first, thank you for this proposal. Secondly, we know that it's a very thoughtful one that took some serious staff time to develop, and we appreciate the staff for taking the time to do it. And you're bringing it forward. As your analysis recognizes, this doesn't meet the full unmet need that's been identified for the long-term care ombudsman program. And also that you have pointed out that this is focused on serving the population in skilled nursing facilities specifically, which is a piece of what the long-term care ombudsman does, but not the totality. There's still a very large population in residential care facilities that these funds by their nature cannot address. So I guess in closing, we would ask that when you convene to look at the Department of Aging's budget, that you consider the additional $2.8 million requested to bring the ombudsman operation up to meeting its obligations. Thanks.
Thank you.
Good afternoon. I'm Cynthia Harding, Interim Director for the Los Angeles County Department of Public Health, and we oversee the licensing and certification program in Los Angeles County. And I want to thank the administration and the CDPH staff for working with us to secure a new 3-year contract. The current contract, as I've stated before, ends on June 30th, 2015. And I want to thank you, senators, and your staff for taking the time to meet with us on this really important issue. The LA County Board of Supervisors supports the governor's proposal for the additional $9.5 million plus this additional $5.3 in the May revised proposal for a total contract amount of $41.7 million. The board's first and foremost priority is to ensure the health and safety of the vulnerable residents in these health facilities, and this additional funding is crucial for our county to be able to fulfill the licensing and certification workload requirements that we perform on behalf of the state. As stated in prior testimony, we've been contracting with the state since the 1960s, and we hope to continue that relationship. And if this new contract and funding are approved, we will fast-track the hiring process to get those new staff on as quickly as possible. But I want to remind you, it'll take us about a year to get them all trained and certified and to be able to be productively working in the field. So that means we won't begin to experience an increase in productivity until the 16-17 fiscal year, with full implementation by the 17-18 contract year, which would be the 3rd year of our contract. And again, I want to thank you and hope that you can support this.
Thank you.
Good afternoon, Chair and members. Michelle Cabrera with SEIU California. We represent the health facilities evaluator nurses throughout the state, both through California Department of Public Health as well as in LA County, and want to thank both the department as well as your staff and the committee for these recommendations, which we support. We support the May revise added $5.3 million. We also support the staff's recommendation to make permanent the 64 limited term positions. When we talk about cost effectiveness and return on investment in terms of this program, I just want to note a couple of things. One, in LA County, our SEIU local was able to negotiate higher wages for LA County health facilities evaluator nurses. In the time since they were able to negotiate those higher wages, their staff turnover rate dropped in half. It was 5.8% in 2014-15, and that compared to the state's turnover rate of 21%. So there was a significant drop in staff turnover, and we also have had experiences of it being very difficult to recruit workers into this work because of the lower pay scale, as well as to retain them because of the competition from the regulated industry, which will then recruit folks away from this. And this is after the state's invested in doing the training and invested the full year. And so what we would ask is that you really consider this staff recommendation to make these people permanent. We can absorb them in other areas of the program once they've helped out with the backlog. And we have a member here to speak as well. Thank you.
Thank you.
Thank you. My name is Sheree. I'm one of the nurses, health facility evaluator, and I do support your proposals. And it does take a while to train. I went through a training for about 8 months, and that was in '99. Things have been changed, and investigating complaints and surveying health facilities, nursing homes, hospitals, and every other, it takes a very long time. Complaint investigation take a very long time. They're very critical. You go through pressure ulcer and falls and fractures and deaths. So we do thank you for reviewing, and we do agree with it. However, please review some of the components, some of the time frames of getting things done. I myself is moving from one district to another district, and I have a backlog of a lot of complaints and stuff sitting there that I do not feel comfortable with. I'd like to get them finished before I move, and I don't like to assign them to anybody else. So we do thank you still, but just remember that. They're very time consuming. Okay, thank you.
Thank you for your testimony. Thank you for your work.
Good afternoon. My name is Lisa Coleman. I'm the Executive Director for the California Long-Term Care Ombudsman Association, and I want to thank the committee members and the staff for working very hard on finding a way to support the local long-term care ombudsman program. We think it makes good fiscal sense to utilize the citation account to support the work of the long-term care ombudsman. We're also in support of the work that the Department of Public Health is doing and support increasing the funding for the LA County program. We're in support of the establishment of timelines for complaint management. This funding, as was identified in the analysis, is only a part of what we need to be complete in doing our job. And we ask that your support will continue when the open item in the Department of Aging comes up for our general fund request. Thank you.
Thank you.
Good afternoon. My name is Aaron Lewis for the Consumer Federation of California, also here in strong support of the proposal for the long-term care ombudsman. This is the very vital service for a very sometimes vulnerable population. Thank you to staff, to the department, and the committee. Thank you.
Thank you.
Mr. Chairman, members, Theo Pejos representing Tenet Healthcare in staff recommendation number 3, a little bit different than the previously testified 2 items, in strong support. We think that the department is doing everything it can to work through the backlog for hospital complaint investigations. They've been extremely responsive to our concerns. We believe that this policy change will be of great help to solve this overall problem, and would urge the continued support of this item. Thank you.
Thank you.
Good afternoon, Matt Robinson with the California Association of Health Facilities. Our members are all the skilled nursing facilities in California and the intermediate care facilities for developmentally disabled. I just want to thank the committee and the department in establishing trailer bill language for the timeframes and closing out the complaints. As we have testified before in other oversight hearings, it's very important to not only the residents but also the providers, the families, and the employees. We would also like to suggest if there was placed for trailer bill language for also defining what unusual occurrences are for entity reported incidents. This is something that we believe is also a backlog to the open complaints, and we'd like to see more of a consistency among the district offices on defining what unusual occurrences are. Second, we also support the $1.4 million funding in the long-term care ombudsman program, including the $400,000 out of the increase to our L&C for our SNFs. The long-term care ombudsmen are very important in our facilities, and they also help with these complaint investigations. So thank you very much.
Thank you.
Laurel Mildred, California Association for Adult Day Services. Regarding licensing fees, we just had some policy comments. We pay these fees, but we're paying a disproportionately higher fee for very little service. We've been told that ADHC is at the bottom of the workload. I also just remind the committee that ADHC is now facing year 4 of the 10% provider cut, so we are now raising fees while we don't have an adequate rate, which has an impact over time. We'd like to see the fees scaled to size to reduce the impact on small providers instead of one size fits all approaches. Thank you.
Thank you.
Yes, Mr. Chair, Member Darrell Kelch with the California Association of Area Agencies on Aging. We manage the Ombudsman program, and we very much appreciate the committee's work on restoring at least part of the money. Disappointed, obviously, that there isn't more, but we thank you and we're supportive of the recommendation.
Thank you very much. Seeing no further public comment, we're going to move to our voting. Starting at the bottom of page 40, we have 4 items that we'll be voting on. I'll be offering some revised language on item 3 when we get there. Item 1 is to approve the budget change proposals and make the 64 limited term positions proposed under the LNC workload permanent. I have a motion. We have 2-0. We're going to hold this open for the chair. And now to page 41 on the agenda, item 2. Right. We're going to take. Okay. I'm going to entertain a motion on the May revised proposal for LA County.
Mr. Chairman, I'd like to just make a couple of comments on that first,
please.
If I may. And I met with the great folks over at LA County, and you know, we've talked about turnover in the state of California and pay parity issues, and certainly it's kind of an aberration that you have one county out of an entire state that takes care of a particular service that the state has been kind of chartered with. But even if we didn't renew the contract with LA County, there's just no way that we'd have the capability of managing the caseloads that exist there. So, but I still think that having one group of professionals in basically one of the largest, if not the largest county in the state of California, we have professionals getting paid more than other professionals in the state. I think that contributes to our turnover rate. So I'm not going to support the LA County proposal only because I feel it doesn't create parity for the rest of the state. So I'd like to see the rest of the state come to parity. We wouldn't have as much turnover, and maybe LA County is the model for what we should be paying these professionals. So
thank you, Senator Stone. So I'm going to move support for the May revised language on the LA County proposal. I'm interpreting Senator Stone's comments as a no vote on that. I am a yes vote, so we have a 1-1, and we'll hold that open for the chair. And we'll move to item 2 at page 41 of the agenda to adopt placeholder trailer bill language to establish timeframes to complete the complaint investigations at long-term care facilities.
Support that. I'll move that.
So we have a motion and a 2-0 vote holding it open for the chair. Moving to item 3, I'm going to share the revised language on that to adopt placeholder trailer bill language requiring the Department of Public Health to notify the facility and complainant if an investigation regarding hospital complaints is not completed in the required time frame. This notification shall document the extenuating circumstances as to why the investigation has not been completed and provide notice to the parties on the basis for not meeting the time frame and the anticipated completion date. I have a motion. We have a 2-0 vote, and we're holding that open for the chair. And finally, item 4, to increase funding by $1.4 million to the Long-Term Care Ombudsman Program at the Department of Aging to facilitate an increase in skilled nursing facility complaint investigations and quarterly visits. And there's some subsections there. Do I have a motion in support of this item? So we have a 2-0 vote on this item 4, and we're going to hold that open for the chair as well. Thank you. We're going to move now to the genetic disease screening program, prenatal screening trailer bill language on page 43 of today's agenda. Good afternoon.
My name is Connie Mitchell. I'm the Deputy Director of the Center for Family Health.
I'm Raquel Gomez, the Acting Assistant Deputy Director of the Center.
We want to provide for you a brief overview of our trailer bill language as part of the proposed May revision. The genetic disease screening program has two major components of the program. One is for prenatal screening and one is for newborn screening. This addresses the prenatal screening program. What we have learned is that the prenatal screening program We've learned that the prenatal screening program is the sole provider of prenatal screening testing in California. But we've learned that because we don't negotiate rates with insurance companies, it appears that we're being considered by some insurance companies as an out-of-network provider, even though we're the sole provider for the state. So then what happens is that they will make partial payments or, in fact, deny payments because they consider us an out-of-network provider. So subsequently, we're collecting only about 81% of what is being billed. We have a fee that's assessed to all patients. It's $207. It's established in statute, it's established in regulations. And so what we want to do with this trailer bill language is to amend both Health and Safety Code and Insurance Code to indicate that all insurance companies should pay the full fee so that we can continue to be fully funded for our services.
Thank you very much. And out of respect for Senator Stone, I'm going to entertain a motion on this recommendation to adopt the placeholder trailer bill language. So we record your motion and vote. We'll have a 2-0 and hold it open for the chair. But I do want to see if LAO or Finance have any comment on this item. Is there any public comment on this item? Hearing none, we'll move forward. We'll keep this item open for the chair, but we've recorded a 2-0 vote. And we'll now move to page 44 of the agenda, the California Clinical Laboratory Testing. Thank you very much. Good afternoon.
Hello.
Please.
I'm Tina Krudoff. I'm the Assistant Deputy Director for the Office of State Public Health Laboratory Director for the California Department of Public Health.
Thank you. Do you want to proceed on this item to provide us with an overview on this issue and the technical assistance provided to the subcommittee?
I'll do my best.
Thank you.
This is a stakeholder proposed technical fix to the current legislation. It kind of clarifies and harmonizes state with federal law. The CMS in March issued new guidelines that will take effect on January 1st of 2016. And until that time, there's some issues. And this is basically a stopgap measure to get us to that point.
Thank you. And LAO, Department of Finance, on this matter, we do have some public comment. If you introduce yourself, please.
Department of Finance. Catherine Scott, representing Abbott Laboratories. We have been working with the department at their CLETAC sort of formal stakeholder process for the last couple of months, identifying the issue with the CLIA regs that will go into effect, the federal regs that will go into effect, and then unfortunately not pull along a quality assurance test required by handheld lab devices that needs to also be recognized in statute so that hospitals and clinics can continue to use those both this year and into the next. So this allows the continuation of a federally authorized quality assurance test for those lab devices. We appreciate your help. Thank you.
Great, thank you very much. We're going to hold this open as discussions continue, but want to thank you for the presentation. We're going to move to page 45 of the agenda. Item 1, Emergency Regulations and Rulemaking Authority. Welcome back, Madam Chair. We've held some votes open for your return, but if you want to...
I'll add on at the end.
Yeah, why don't we get, we're right at our last item, I think, so we'll get through that and then
Good.
we can go back and do the votes.
Thank you, sir.
Thank you, Madam Chair, members. David Panish from Covered California. Appreciate the chance to testify on this. Last year, Covered California requested a 2-year extension for its Emergency Regulation Authority. We needed the flexibility to accommodate changes in federal regulations and other changes related to implementation. We were allowed a 1-year extension with the proviso that we might be able to come back this year if the need occurred. Since then, we've been moving forward to make permanent our regulations in a number of areas, including fingerprinting, background check rules, small business appeals, and enrollment assistance and navigator program. But with federal regulations continuing to change, we believe it's necessary to continue to make a few changes in our regulations, particularly in the critical areas of eligibility enrollment. Our current emergency regulations will expire 2 years after they were adopted, and they will expire, the first set will expire on July 15th of this year. Others will expire in September. That would leave us without legal authority in a number of key areas. Finally, the proposed trailer bill language exempts our standard benefit designs from the formal rulemaking process. Without this exemption, we'd be required to do new permanent regulations every year to reflect changing federal rules, such as the actuarial value calculator. To ensure transparency, the standard benefit design would be subject to approval by our board after at least 2 publicly noticed board meetings. With respect to procurements, the language would require the board to adopt a contracting manual containing the same processes and requirements as the state contracting manual, so that formal rulemaking processes wouldn't be required every time we issue a procurement, as in the case for our qualified health plans, which we have to do every year. With me is Brandon Ross, our Deputy General Counsel.
Why is this a budget play versus you looking at a legislative remedy?
Senator, I think our argument would be that because particularly in the area of eligibility and enrollment regulations, if we move to an area where we don't have where we don't have regulatory or legal authority, we think that there's potential for litigation, there's a potential for enormous uncertainty, particularly in the areas of CalHERS, and we think that that does raise some budget nexus. But I also would say that because we were asked to come back, or we were invited to at least have the option of coming back, we wanted to avail ourselves of that so that we could move this more quickly, given our very accelerated timeline.
So I was not chair last year, so I didn't extend an invitation. And so you were requesting 2 years, you were given 1 with the expectation that you would need the additional year and therefore come back, or was the process questioned then in terms of budget versus legislative action?
My recollection is that there wasn't an issue. I mean, I'm sure that there were issues about whether it was appropriate for the budget process. With respect to the debate that was going on in the committee, I think there was some question about the policy itself and whether or not whether our stakeholders were included and how that process rolled out. So,
Hence, for me, a legislative process to allow that to be vetted. So that's the whole point of me making that distinction.
we hear you, Senator. So this year, before we even attempted to move forward, we consulted with some of our key stakeholders who had raised concerns last year, most notably, and we love all of our stakeholders equally, but Western Center and Health Access, and I think they would be, I believe they're here in the audience and can.
Oh, they're not. They left you.
Well, I have.
Oh, there she is. I'm sorry. There she is. Oh, yeah, they're both there.
And so I would ask them about whether they have a view on this.
Perfect. Perfect. Any questions, Senator Monning? LAO Finance? Okay, so public comment.
Linda Way with Western Center on Law and Poverty. As mentioned, we talked with Covered California staff earlier today and view these changes as technical and conforming changes, so have no issues with the proposal at this time.
How lucky for Mr. Panish. Next witness.
Pam Ma with Health Access California. We've also been in conversation with Covered California, and we do not have any concerns, nor do we oppose at this time.
Thank you very much. We'll hold the item open, sir.
Thank you.
Okay, thank you. All right. Yes, yes, that would be yes. It would be official-like.
So if we go to page 34 of the agenda, folks here, we're just catching up on some of our voting and allowing the chair to add on budget item 12 at page 34, adopting placeholder trailer bill language. Madam Chair?
Aye.
So that's a 3-0. And now turning to page 36 on item 1, high-cost drug proposal. We have a 2-0 vote to approve.
Approved, 3-0.
We got a 3-0 vote. Moving to page 38, this was broken down on AIDS Drug Assistance Program. Subcommittee staff and recommendations to, first item was to approve, and we have a 3-0 there. And then augment on number 2 bullet is augment, so we have a 2-to-1 vote there. And number 3 augment, we have a 2-to-1 vote there.
Right.
Moving to page 40 of the agenda, at the bottom on licensing and certification program, recommendation to approve the budget change proposals that make the 64 limited term positions permanent. Yes. We have now a 3-0 vote on that. We did break out a separate vote on the recommendation in the May revise related to LA County employees. We have a 1-1 vote there. Now we have a 2-to-1 vote on that. Then item 2, adopting placeholder trailer bill language. Madam Chair, we have a 3-0 there. And down to item 3 with the changed language. On that one, we have a 2-0. Now we have a 3-0. On item 4, we have a 2-0. Now we have a 3-0. And now page 43, adopting placeholder trailer bill language on genetic disease screening program. We have 2-0. Now we have a 3-0. And that's all.
The rest of the items were held open. Thank you very much, Senator Monning, and Sub 3 stands adjourned.